So here's Parkinson's disease, which we know involves damage to the substantia nigra in the basal ganglia. Here's a healthy person's substantia nigra. And here's a patient with Parkinson's disease where these cells have died away. Typically, at least 80% of these have to die before a person shows Parkinson's disease symptoms clinically. Here's an injection of a radioactive stuff using PET that binds to dopamine-receiving neurons. And you can see that in the living Parkinson's patient, there's tremendous reduction in these receptors waiting for dopamine. In a living patient, specifically dopamine receptors. So that's a disease. Here's why video games are taking over the world. Oh, no, not yet. We can do one more thing, sorry. We can track a disease from a typical person to a person with moderate Parkinson's disease or severe. So not only within the disease we can see differences of gradation. But here's why video games are taking over the world. Because if we take a healthy person, young adults, give them this kind of dopamine-binding tracer and have them play a video game, two things happen. A, the parts of your brain that are involved in reward, dopamine is the strongest reward neurotransmitter that we know. Things go crazy. And what this graph is showing you is the better you do, the more rewarded you are. This is why you will go for the next level, okay? Because to get that dopamine fix, you got to keep going, all right? The better you are. So, I mean, and we think these reward mechanisms underlie everything in many ways. They relate to everything. Why do you do whatever you do? Because at some level, in some way, you find it rewarding. And the data is very compelling that way. The last